What are the most common symptoms or complications associated with your diabetic progressing? Well, there are many complications that can be associated with diabetes. And today we're going to be starting with the lower ones, or maybe the less ones that are likely known associated with diabetes. And then we'll get to more advanced. Some of the most early stages of symptoms for type 2 diabetes are commonly fatigue, right? And the reason why someone becomes fatigued is, remember, sugar or glucose is our fuel. And the purpose of our fuel is to get into our cells. And inside our cells, we have our engines, right? Imagine if you were driving your car and the gas from your gas tank never reached your engine. What would happen to your car? It would just stop running and it would be dead on the side of the road. Well, our bodies are no different. And when there's a certain percentage of our cells that are not getting the fuel that they need, we feel tired because our body is going to prioritize that energy for our organs, our brain, our heart, our lungs and kidneys, etc. And you are going to be left over with whatever's left over. So if you're experiencing fatigue and you have diabetes, well, guess what? You have a complication of diabetes. It's progressing. What's another complication? Brain fog is a very common complication as well. And in the early stages, it could just be very minimal, etc. But as it progresses, it can become very advanced. And we'll go over that in a minute as we go into the advanced progressive symptoms of type 2 diabetes. But another one is weight gain, because if your sugars can't get into your cells, well, that sugar is going to turn to fat, and that fat is going to be stored around the belly area or in the buttock area in females, and you're going to start building that fat and you're gaining weight. And it's very challenging and difficult to lose that weight, even though you may be exercising on a regular basis, because the body, the metabolic function, if you will, is declining. And so you're burning less energy throughout the day as you become sicker and sicker and sicker. You may start noticing other symptoms as the progression continues with your diabetes. Things like inability to sleep. Sleep becomes more challenging for individuals. They're waking up multiple times throughout the night. This is commonly associated with the adrenal glands, because the adrenal glands control what's called our circadian rhythm, our ability to sleep and stay asleep. And as you're fluctuating blood sugars throughout the night, that fluctuation will trigger cortisol responses, and cortisol responses is like little stimuli to your brain, and it wakes you up. And if this has ever happened to you, you've woken up, it's challenging to get back to sleep. Well, these are all symptoms of your diabetes progressing. So even though you may not even have high sugars and you're doing a good job managing your blood sugars, taking medication, you're doing all the right stuff, these symptoms will progress, because remember, as diabetes gets worse over time, the cellular disease progresses, even though the sugars may be kept in check. But as things progress and your diabetes gets worse over time, these symptoms start to become more of a threat, right? And so oftentimes we may start noticing maybe your vision may start to be getting impacted. You start seeing double vision, blurred vision. You could even go to your optometrist or ophthalmologist and they're saying, we don't see any problems, but you're starting to identify problems in the eyes, maybe even some blind spots. And as things progress, we know as things get really bad with diabetes, the worst case scenario is what? Blindness. And if you've ever seen anybody with that type of diabetic condition that led to blindness, it's very disturbing, right? For a condition that we know you can fully reverse. And again, all of these things are fully reversible. Maybe not the blindness after that occurs, but I'm saying these complications are reversible if you capture them in the early stages. Another area sticking to the head is, we talked about this a second ago, is brain fog. Now, as brain fog continues to get worse, the problem is that can lead into a condition called type 3 diabetes. And for all of you who have never heard the word type 3 diabetes, well, that's also known as dementia and Alzheimer's. So individuals who have type 2, you're already at risk of developing type 3 Alzheimer's and dementia, because the impact on the ability for sugar to get into your brain or glucose to get into your brain and optimize your cells, as that declines over time, eventually can lead to a diagnosis like Alzheimer's dementia. The scary part about Alzheimer's and dementia is that it can take upwards of 30 to 50 years before someone is finally diagnosed. So think about this. Let's say someone is diagnosed with Alzheimer's in their 70s. That potentially started in their 20s or in their 30s. Like, this is a very scary game, as this problem can happen very early in life, because remember, blood sugar dysregulation or diabetes takes decades to develop before you start experiencing the symptoms. Speaking of that, another symptom that is very common with the progression of diabetes is elevated sugars. Remember, elevated sugars is not the cause of your diabetes, It's a symptom of the diabetes progressing, which is the reason why so many people have to take more and more medication until eventually they're taking full-blown insulin. Another area as things progressively get worse with complications is cardiovascular disease, right? We can have things like heart attacks and strokes. The number one cause of death of a type 2 diabetic is heart attacks and strokes. So my question always is, how many of those individuals who died of a heart attack and a stroke actually had a diagnosis of diabetes? Now, was diabetes the cause of that heart attack and stroke, or was it some other condition that was similar to that? In most cases, it's the diabetes, but it's being counted as the cardiovascular issue. And here's the thing. When you're dealing with these types of complications, the reason why they're getting worse because you have a progressive disease process. Remember, diabetes is considered a progressive disease. It's going to get worse no matter what because the focus is typically on the symptoms, i.e. the elevated sugar, and trying to lower that and not addressing the true cause of diabetes, which is the cellular disease process that we talk about and how we help individuals in our office. And if you want to learn more about that cellular disease and how we help individuals reverse type 2 diabetes, make sure you download my guide below down there and make sure you look at that and read that over multiple times to learn what needs to be done in your specific situation because each type 2 diabetic case is unique. So click that link down there, download the guide. Trust me, you will not regret it. So as we move forward and continue with this progression of diabetes, we can see other types of symptoms as well. Things like circulation can become an issue. So as you lose circulation to like your extremities, your hands, your arms, your legs, even your feet, you start maybe having some swelling. And the ability to walk becomes more difficult because when you're swollen like this, it's painful. It's painful in the joints. You can get so much swelling that it starts tearing your skin, increasing the risk for problems with infection and more advanced type issues as these things progressively get worse. And of course, as we continue in that type of scenario here, another symptom that is commonly there is neuropathy. You may be familiar with neuropathy, where you get things like tingling, numbness, burning, pain, etc. Is because the nerve cells, right, are damaged. And why are the nerve cells damaged? Well, they're damaged just like any other cells in the body as this progressiveness of the diabetes continues. Remember, diabetes is a cellular disease. So any cell, nerve cells, heart cells, lung cells, skin cells, any arterial cells, all of these cells, everything in our body is made of cells, can become damaged. And the more cells that are damaged, that's where you start to experience the complication first. So for instance, if one person, if their nerve cells are being damaged faster than other areas, they're going to experience neuropathy. And another person, if it's cardiovascular cells, they're going to have cardiovascular problems. If it's their brain cells, it's going to be brain. If it's their eyes, they're going to be their eyes, etc. So we have all these types of complications. And another one we know is very, very common as well is kidney disease, right? The kidneys are a very common area as things progress with diabetes to get worse and worse and worse, eventually leading to a full-blown kidney failure that can lead to dialysis. Now, unfortunately, with dialysis, it's very dangerous and very consuming, right? It's in most cases, you'll be in dialysis for 2 to 3 hours, 3+ times per week. And in some cases, people may get so sick they have to go to do like a kidney transplant, which also has its potential risks as well. So think about this. We have a disease process called type 2 diabetes that can negatively impact so many different areas, right? And one person could be the brain, the next one the eyes, the next one the heart, the next one the nerves. Is there any other disease process out there that's like this? No, not really, except for maybe metastatic cancer. But at that point, most people know they have it. And it's advancing very rapidly at this point. But we have a disease process that is going to impact your body. And that worst case scenario, increase the risk of an early death. We know type 2 diabetes reduces the risk, or reduces your lifespan, I should say, by roughly about 10 years. So let's think about this. If you as an individual know that someone in your family has lived until like 91, for example, that means you have a life expectancy to live to 91. But if you have type 2 diabetes, if you make it past 81, that's a win, because for most diabetics, they're going to actually die earlier than that, 10 years or more earlier, because of the condition, because of the destruction it does in your body, because it impacts your cells, destroys one cell at a time. And when enough of those cells are damaged, then eventually the individual starts experiencing the symptoms. And this is what's so scary about diabetes, because many times, and many of you probably watching this video are thinking, I don't have any symptoms, I feel just fine. Well, that's why they call diabetes a silent killer. Because individuals like yourself, you haven't had enough damage occur. But trust me, you live long enough with diabetes, you're going to start noticing the symptoms. And if you want to learn more about how we help individuals to identify their specific condition, why they have this cellular disease, and what's causing this cellular disease, make sure you watch this video right here, because I go over in detail and specifics of what you can do and how you can identify it for yourself. Or if you need additional help, you can always reach out to us. We'll talk to you soon.